Tucked away in the Health Sciences Center in Winnipeg is the Surgical Modeling and Simulation Robotics Laboratory. Inside this very modest facility, you'll find a team of innovators developing an ambitious project that dramatically improves surgical training and practice in the head and neck regions of the body. During his postgraduate studies in Toronto, Dr. Hochman observed that the number and frequency of adverse medical events in these complicated and barrier-filled regions of the body was disturbing. He began to explore new ideas in modeling and simulation. He returned to Manitoba and fortuitously met with others who shared his vision.
I was exceedingly fortunate. When I came back to Manitoba, I met with some incredibly bright, capable individuals, and we shared similar passion to trying to improve the surgical environment.
Our primary focus is on developing simulations to educate medical residents and medical students and take advantage of the technology that's out there to develop those simulations. There's a lot of interesting things that we have that we can use to teach high-level medical skills.
We pursued different forms of simulation. One of them is entirely virtual, where you can watch a television screen in 3D and hold a robot with an end effector in your hand and interact with virtual tissues as you would in the actual operating room.
So if you're drilling a temporal bone, for example, you can drill into the temporal bone with the drill on the screen, and you can feel the forces in the drill as you hold it in your hand.
When they hold this end effector in their hand, they're actually able to feel the force feedback of doing true tissue dissection. So it's a very exciting form of simulation. It's all computer-based. Trainees love it. They find it very interesting and involving.
Dr. Hochman, Dr. Unger, and their team have now developed an exceptionally precise 3D prototype. This technology is so sophisticated, it can take a CT scan and produce a physical model that is entirely specific to the patient, allowing the surgeon to obtain an accurate preview of what they can expect during surgery.
3D printing or rapid prototyping has become exceptionally commonplace, both within industry as well as within medicine. But generally, surface rendering has been the target of all these different areas. And we needed to get internal anatomic fidelity. We needed to get the insides right. So we had to create an entirely different algorithm to print our temporal bone models.
So now you have a 3D model. It benefits the students who are learning to become more proficient at surgery, and it benefits the patient because you have a better, obviously better trained surgeons, but also you can pre-see what might go wrong during a surgery.
Right. So we have at this point developed a library based on micro-CT data for our trainees. So we don't just have a singular model. We have a number of models, some being very easy to dissect, some being very difficult to dissect. So we can, again, walk them through the skills that they need to acquire to be excellent surgeons. With reference to preoperative surgical rehearsal, we can actually take an individual patient's imaging data and produce a physical model that is specific to them, do the surgery on that model with the exact same tools and in an analogous fashion as we would in the operating room, and know where we might get into trouble so we can perform better surgery for our patients. And this is the only place in the world where this can be done. So what we have done, which is different, is we have the insides being accurate. We have excellent representation of the air cell system, as well as requisite density throughout the entire specimen. And that's what our value has been in 3D printing in medicine.
People look at our haptic systems and go, wow, that's really cool, but when we get the surgeons to try them, they say this doesn't feel like the real thing and it's not helping us. So to get around that problem, we've developed a system that I'm calling mixed reality. It's a little bit like augmented reality, but for touch.
And this would incorporate the osseous or bone-like properties of the physical model, which is where it excels, and allow a lot of the assessment tools that you can gain out of a virtual model to be in one composite holistic model. When we go to conferences, there's a lot of interest and it's a lot of, has a lot of gee whiz factor. You might even say sexy factor. So people are excited by it. I love my job. I do. I always tell patients that I'm functioning as a carpenter. And so I like that technical side of things. And then the research provides me different type of stimulation. So I also very much enjoy that too. So I come to work invigorated every day.